Good morning, everyone who's with us this morning on this wonderful day before our holiday weekend. As you guys know, many of you have been with us hopefully for a while. This webinar is a part of a series of real-time solutions that is brought to you by the Apple Valley, Burnsville, Hastings, Lakeville, and River Heights Chambers of Commerce. Just some housekeeping items this morning. All participants are muted, so please use your Q&A feature to ask questions, and we will get to as many as we can following Paul's presentation. We are recording the webinar, and so it will be available on our partner websites after this is done. And just a reminder that the goal of these webinars is really to help us and help you address those business concerns that we are having as we continue to do business during the pandemic. My name is Krista Jack, and I am the president of the Lakeville Area Chamber of Commerce. And we're lucky today, we're very excited to have Paul Dettmann with us. Paul is a customized training representative from Dakota County Technical College and Inver Hills Community College. And he has 10 years of experience working in industry and maintenance, and maintenance supervisor, and you have another 16 years, Paul, both at the K through 12 level as a shop teacher, and then at the college industrial tech teacher. So lots of teaching experience, and then in the last 3 years, he's been a continuing education customized training rep with the colleges. So again, Paul is going to talk to us today about making sure we're maintaining health and safety work environments. So Paul, I'm going to turn it over to you. Take it away.
All right, thank you, Krista. Good morning, everybody. I guess first of all, some housekeeping. Put your questions, if you have questions, into the chat. I don't quite have the chat open up in my screen, so that would help. Also, the presentation will be available for you to download on the site afterwards. And as I say on the first slide here, please note there are many links that help inform yourself in the instructor's notes on the presentation. So rather than giving you a presentation on a bunch of different websites and visiting a bunch of different websites, I just thought I'd give you the essential information and then put the links to where you can find relevant information into the instructor notes section. So again, welcome. This slide series is part of a larger training that I've helped been put together by the National Institute of Health and Science and have modified it to fit Minnesota and our current situation. So the title is Don't Stop Believing, Returning to Work During COVID-19. Again, this is a brief presentation, a larger presentation that we can offer. It also includes Minnesota's fact information and websites, as I said in the instructor notes section. So this is for essential workers as well as returning workers. So everybody that's returning to work, this is pretty much geared towards you. We have our grocery store workers, we have our health workers, we have our sanitation workers, and we have our postal workers. So we know that COVID-19 is rapidly changing on a daily basis. We're getting more and more information, but it's important to rely on information that is from the CDC, OSHA, or NIOSH, State Health or Business Industry Department, as well as peer-reviewed publications. A lot of the problems we have is social media. Social media is great. But, you know, as the old joke goes, kind of like, well, I heard it on the internet, so it must be true. That's not always the truth. So go to the CDC, OSHA, or NIOSH sites, or even Minnesota Department of Labor and Industries websites, and you'll get the factual information there. So goal and learning objectives. Our goal today for our presentation is to increase the health and safety awareness for all returning workers to prevent possible exposure to COVID-19. After attending, our participants will be able to assess risk factors for work-related exposure to COVID-19. Basically, we're empowering the workers. Define some protective measures employers should implement. Understand workers' rights to a safe and healthy workplace. Review strategies for protecting mental health during times of crisis. That's very important, is remember your mental health of your workers. All right, so who are the returning workers? There are several different types of returning workers. We have delivery, we have retail, we have postal, we have communication workers, environmental and janitorial services. We have healthcare institutional workers, public health and safety workers, law enforcement. We seem to forget them at times. Public safety as well as first responders. First responders and public health and public service workers are sometimes overlooked, but they're important. And then the energy and utility workers. Transportation, food, including not only grocery store workers, but restaurant workers, etc., as well as farmers. We have manufacturing and constructions. We have to keep things moving. We have to keep building. And then we have defense workers, defense contractors, keep things moving along. All right, so what is SARS-CoV-2? So SARS-CoV-2 is the virus that causes the coronavirus disease 2019, named COVID-19, short for that. When we talk about SARS, STAR stands for Severe Acute Respiratory Distress Syndrome. So that's what the acronym is all about. It spreads easily from person to person, particularly through sneezing or coughing. Humans have little, if none, immunity. Studies are starting to show that people that have been exposed and have recovered have some limited immunity to it now. They're not quite sure. Again, this is all evolving in the last 2 days, 2-3 days. They've been saying for the last week or so they think that they might have it, but it's confirmed that they might have some now. And if you want a detailed more information, I've gone ahead and I put the link right here. This is one of the few links I put in the presentation for you to go visit, provide you good factual information. Again, coronavirus is a large family of viruses that are common in people and many different species, including cattle, cats, bats. Rarely, animal coronaviruses can infect people when they spread from people, However, there are a few, such as the MERS and SARS, and now with our new coronaviruses, but rarely do any of the other viruses that are in animals spread to people. So SARS-CoV-2 virus is a novel strain, meaning that it's new. When they say novel, when you hear it on the news, they talk about novel strains, or the scientists talk about novel strains. They're talking about a new strain. As a result, the humans do not have not developed immunity to COVID-19 and therefore can be infected. Example is when people have measles in childhood and are vaccinated, they develop antibodies and certain level of protections. So when we have, we're familiar with our MMR shots, we are injected, we receive the virus, dead virus, so we're able to build antibodies. We don't currently have those yet. So increased risk factors. Those with elevated risks to exposure include people in close contact with other people with COVID-19, known or unknown. Again, the biggest scary thing is that there are people that are asymptomatic, can have the virus, show no symptoms of it, and can spread it unknowingly. Healthcare workers caring for patients with COVID-19. We hear this quite frequently. It's always a news on the story on the news. Nurses are protesting because they don't have the right PPE or enough PPE. And then we hear of our senior living facilities where that it seems to be a special problem with those. Working provided critical services and operations. Some sanitation workers, frontline workers, especially such as grocery stores, etc. We hear a little bit about that. Anybody interfacing with the public is susceptible. The transmission of the disease. COVID-19 is spread mainly from person to person through coughing, sneezing, and possibly talking and breathing. We all know those people that tend to expel saliva when they talk or get really excited about something. That's one way that can be expelled. Coughing, we're all familiar with that. Sneezing, proper precautions for that should be cough or sneeze into your hand or into your arms or your elbow, if not wearing a mask. Droplets, when they talk about droplets, they're talking about respiratory secretions from coughing or sneezing, landing on surfaces, mucosal surfaces, such as your nose, mouth, and ears. So that's one of the reasons why it said, please wear a mask. So if you do sneeze or cough, those droplets are trapped and we're not spreading and they're not contacting other people on the nose, mouth, or eyes. When they mention aerosol, they're particularly talking about solid particles or liquid droplets suspended in air. There has been studies trying to figure out how long the coronavirus stays in the air. Nothing definitive has been established yet to my knowledge. I may be incorrect, but to my knowledge, there's nothing been definitive on how long. You hear anywhere from a couple minutes to an hour. Contacts, when they talk about contacting, touching something with the virus on it and then touching your mouth, your eyes, or your nose. So again, we need to be very careful about what we do, what we touch, and then where we touch after that. So that's why we have hand sanitizer. We want to use hand sanitizer as much as possible because humans touch their face, I've heard 20 times an hour, 30 times an hour. So that's, easy or out in. The length of the virus lives on surfaces depends on the surface, I guess. I've read anything from an hour, 2 hours to 24 to 36 hours, depending on what the surface is. But again, I haven't read anything or heard anything that is a definite. So it's better to be cautious than not. Other possible routes through fecal matter. There have been studies that have shown that the coronavirus can be detected in fecal matter. So if you're caring for elderly folks that wear diapers, and through that matter, you need to be cautious with that. So treat it basically as another influenza, such as the flu, is a way to look at it. It can be transferred from person to person through coughing and sneezing, but we won't know the full effect or how it's transmitted until scientists had time to evaluate it. Right now, they're busy trying to figure out how to help people with it and develop this stuff like that. Important, employees and workers' responsibilities. This is important for returning to work. Although there are no OSHA standards that deal specifically with the coronavirus, there are OSHA standards that cover personal protective equipment and respiratory protection. Many of these OSHA standards include training requirements for workers, and they can be found at the Minnesota OSHA website. And I have a link to that in the instructor notes. However, the OSHA General Duty Clause requires employers to provide a workplace free of recognized hazards that can cause serious physical harm or death to the workers. So that's one thing that I don't think OSHA is going to be going out and citing people for that. But it's up to the employer to make sure it's communicated with their workers to the fact that they're aware of the fact that it's there, and for the employers to provide adequate PPE, which we'll talk about in the next slide or so. Workers have the right to file anonymous and confidential complaints. It's usually a good idea to try to resolve the safety health problems with employers before filing an OSHA complaint. It also recommend directly speaking with the area OSHA officer personnel to obtain assistance in filing a complaint. So if your workers are going to file a complaint, or if you want to file a complaint, it's advised you talk with an Minnesota State OSHA officer before doing so. They will ask you, they'll advise you, it's kind of like ask you if you have worked with your employer and try to encourage you to work with your employer, try to get this resolved before they're involved. So it's just best to do that. Workers unions and the public have filed complaints with OSHA and public health authorities. Political leaders and politicians during the pandemic where employers refused to maintain social distancing and other basic protections. So we hear a lot about that in, I guess, the meat packing more so. Again, just because it's a hot topic, it gets blown up out of proportion. So again, work with your unions. If you have unions, work with your employees to set up some social distancing and what's required, what you're expecting of workers. That way it avoids a lot of hassle. Nobody likes that. All right, key steps for employers preparing to manage an epidemic in the workplace. This is getting into building your plan that you need to build in order to reopen. So you need to prepare for the threat. So basically, you need to sit down, come up with your disaster plan. That's what I mean by preparing for the threat. You need to implement preventive measures. So what are we going to do for preventive measures? PPE, etc. If we go to the grocery store, they're wiping down the conveyors after every customer. They have plexiglass up in front of them. And then you also need to manage recovery from post-epidemic. So how are you going to recover after this epidemic has gone away or well under control? So just some things you need to think about. Employers are responsible for preparing and managing for epidemic in the workplace. Workers and unions involved can ensure that plans include the real world experience frontline workers. Again, a lot of times, not belittling management or owners, but we're busy managing, trying to think forward and trying to keep the business planning for what's going to happen months ahead. And we're not right down there on the front line, and we forget about what's actually going on minute by minute. So include those frontline workers so they can keep you in the loop. Although details and preparedness and responses are being beyond this briefing, the sites below and the notes are excellent guide to help you develop your plan. And I have a link to the CDC, Get Your Workplace Ready for Pandemic, OSHA's guide on preparing for influenza and pandemic. Again, they're considering this very much like a influenza pandemic. And then there's also OSHA has a guide out for preparing workplace for COVID-19, also in the instructor notes. So those are 3 very helpful links.
I'll just give you a time check. We got about 10 minutes left.
Okay, sounds good.
Thanks.
All right. Key elements. So we need to work about management leadership and employee participation. Again, we want to have the management provide leadership, and we want the employees to participate. So in your workplace plan, you also need to identify hazards and how you're going to assess those hazards. Hazard prevention and control. Okay, we've assessed our hazards, we've identified them. What are we going to do to prevent them and control them? We need to educate or train or both, or, as I say, educate and train your workers. We need to evaluate what's going on and make improvements as much as possible. You need to support workers who are exposed. Again, mental health support for workers and their families. Again, check out Minnesota Department of Labor COVID-19's resource site, which I've put here in the slide as well. So that's a very, very, very helpful site for Minnesota. Resuming work after closure or shutdown. Employers should update your risk assessment. Again, like I said, for your opening plan, you should go update your risk assessment. What are your possible risks? Where do they lie? Carry out adaptations to the layout of the workplace and organized work to reduce exposure to COVID-19, i.e. social distancing, barriers. You're going to have your employees wear face masks, make customers wear face masks. What are you going to do? Inform workers about changes, new procedures, and provide training before they resume work. So don't just welcome your employees back and say, here we go, quick outline. Sit them down, run them through stuff. Make sure they completely understand it. Pay special attention to the workers who are at high risk and are prepared to protect the most vulnerable. So again, those folks that have underlying diseases such as diabetes, are overweight, etc. Pay special attention to those and make sure they're well protected or not as exposed. So what about exposures at work? CDC recommends that exposed workers with any symptoms may continue working. Employers should perform temperature and symptom checks, disinfect and clean affected area surfaces and equipment. You want to trace contacts of the exposed worker and send a sick worker home for isolation. Workers should wear masks, keep social distancing, report symptoms, and stay at home if they're sick. Okay, there's concern that this approach does not address the potential for asymptomatic carriers to infect workers and the public. So that's one concern that has been, I guess, raised about the CDC's guidelines. But if you're doing your part and your workers are participating, they should be safe. All right, protecting workers. Start with the most effective methods to protect your workers. This goes for any and all hazards. You want to try to eliminate it. Well, obviously it's hard to physically eliminate the COVID hazard. Substitution, replacing the hazards. Well, that's tough too, because then you're replacing your customers with other workers. Engineering controls. This is where we see the plexiglass, etc. It could be also the high volume of air turnover, etc. within a building or within a workstation. It could be checking temperatures when they walk in the door. Administrative controls. Change the way people work. This is our social distancing. You don't have people standing over top of each other. Then we have PPE, or protecting the worker. So that could be your face masks, etc. When talking about the face masks, OSHA has relaxed their standard on face mask to the fact that you don't have to have the initial fit testing. Basically, what they're saying is the face masks that have the nose pinch on it, or if it restricts the breathing, can possibly restrict the breathing, it needs to be fit tested. Well, OSHA has basically suspended that rule. That is posted on the OSHA website as well. I believe I put a link to that in the notes. So we don't have to worry about fit testing people for right now. What can all essentials workers do to protect themselves? Be informed, be prepared. Practice social distancing, at least 6 feet. Wash your hands frequently. Use alcohol-based hand sanitizer. Avoid touching eyes, nose, and mouth with unwashed hands or sanitized hands. Stay at home when you're sick. Cough or sneeze into a tissue or your elbow. Clean and disinfect frequently touched objects and surfaces, such as cell phones. Be prepared if your children's school, daycare facility, or your work site is temporarily closed. Have a backup plan. What am I going to do? That's very important. General principles for protecting workers. Again, you want to increase physical distancing, at least 6 feet. Everyone should wear masks. Again, I have that starred by meeting the fact that OSHA has relaxed their fit testing requirements. Flexibility is where and when to work. So again, stagger your shifts, stagger your breaks. Wash your hands frequently. Do not share equipment. Practice good housekeeping. Increase cleaning and disinfectant generally thoroughly after confirmed COVID-19 exposures. So as we've seen before, some companies have shut down for a day or two to do deep cleaning after some workers have tested positive. So again, increase your cleaning and disinfect generally. And if you have confirmed case or two, go ahead and shut down and do a deep cleaning.
Paul, I got another time check for you. We're at about 5 minutes now too.
Okay.
So I just want to make sure that everybody gets through that good information.
Sure. Okay. 5 steps to properly wash your hands. You need to wet your hands with warm or cold water. Doesn't really matter. Turn off the tap and apply the soap. Lather your hands up. Scrub your hands for 20 seconds. If you need a timer, hum Happy Birthday song twice from beginning to end. That takes you about 20 seconds. Rinse your hands well under the water and dry them using a clean towel or air dry them. All right, when you use disinfectant, such as we see all the time commonly in the grocery stores, or if you're going ahead and clean down all your equipment, or whatever. If you're reopening, you have dust on your stuff, clean it off first. Remove the dust with detergent or soap and water. Another thing is to open the windows and use other ways to increase ventilation. You want to avoid spraying, and if you spray, put it on a sponge or a rag so less goes into the air. Again, that way I see this frequently in the grocery stores. If you would spray it onto a sponge, less would go in the air and less chances of it spraying on people or getting back into the air. And a little goes a long ways on a sponge. And you're able to clean it off a little bit better with a sponge. All right, so self-care and stress management. Actions individual workers can take to increase the resiliency. You need to have healthy habits. You need to have good nutrition. You need to have adequate sleep. You need 7 to 8 hours of good sleep. You need to get out and exercise. It doesn't necessarily mean vigorous exercise. It could be out just walking outside, doing something. Social support. Social support we know is important. You also need to take time to relax. Nutrition includes not eating sugary foods, a whole lot of sugary foods, avoiding a lot of caffeine or your high sugary drinks, such as a lot of people drink those energy drinks. So try to avoid those. Try to cut back on the Mountain Dew if you're a Mountain Dew fan. Start drinking water. So nutrition, exercise, and sleep are very important. So mental health and stress, considering the following steps. Use your smartphone to stay connected with family or friends. Shift from texting to video calling to feel more connected. We have more of a connection feeling when we actually see a person. Keep comfortable. Do more things that you enjoy at home. Practice stress relief. Whenever you feel anxiety building, do some deep breathing, exercise, take time off, read, dig in the garden. I know a lot of people this is garden season, so go out and work in your garden for a while. Dig in the dirt, get some dirt therapy, as I call it. Just basically whatever works for you, but practice some stress relief. Avoid unhealthy behavior, such as excess drinking. That will increase your anxiety afterwards. Keep looking forward. Make some plans for 6 months down the road. Keep focused on the future. We'll get over it. We're all in this together, but we'll get over it. Make plans. Keep thinking positive. Keep looking forward. That definitely help your mental health. So begin an action plan. So actions can be at the individual organization level. So again, why I include this is it can be individual or for the business. You want to have your action item. What are you going to do? Who's going to be the responsible person? What steps are they going to take? Date when it's going to be completed, and notes. The key to the process is accountability and feasibility. So you got to hold everybody accountable. That's why we have the list for who's responsible for it, etc. Again, the Department of Labor and Industry, Minnesota website has great tips for creating your outline plan. Again, thanks for attending the program. We hope you benefit from today's increased awareness and the methods to be used to protect yourself and your coworkers from COVID-19. Again, please share this material with the coworkers, supervisors, and organizational leaders. If you should have any additional questions or wish to have an in-depth workshop presentation on this, or have any questions just in general, you can contact Robert, my boss. His email address right there, or you can contact me via email or phone. Again, don't stop believing, and return to work during COVID-19. Thank you very much, and best of luck to you. Be happy to answer questions now if we have any.
Paul, thank you. That is a lot of information. And as Paul said, we will make that available to folks. So not only the recording, but we will have the PowerPoint available on our partner websites as well. So thank you again for joining us today, Paul. Just a reminder to everyone, our next webinar is going to be next Wednesday, and it is going to be with Matt Scopp, an attorney with Doherty, Melinda, Solfest, Hills, and Bauer. He's been with us in the past. It'll be a nice continuation of this because it will be talking about our business liability as it relates to COVID. So be sure you register for that one next Wednesday, 8 a.m. Again, this webinar is provided in partnership with the Apple Valley, Burnsville, Hastings, Lakeville, and River Heights Chambers of Commerce. And the recording, like we said, will be made available. So thank you, everyone. Have a wonderful Friday. Have a great holiday weekend. And we will see you later. Thanks again, Paul.
You bet. Thank you very much.
Right. Take care. Bye-bye.
Bye.